Chemo patients receive comfortable care in new surroundings. Chalk it up to great patient care. New information boards give patients all the important details. And Sinai-Grace Hospital names its Nurse of the Year. These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. If you've been diagnosed with cancer, you want the best treatment possible. And Sinai-Grace Hospital is proud to offer patients world-class care. A comprehensive cancer center will soon be housed in the Radiation Oncology building located on Sinai-Grace's campus next to the visitors parking lot, including chemo infusion and radiation, spiritual, dietary, and other support services. Patients and medical staff say they're pleased with the new chemo infusion room.
I think the primary reason why we have the chemo infusion room over here is that we wanted to first focus on the patients and their convenience, because we have a number of patients that are getting both chemotherapy and radiation treatments, but also developing a cancer center. That would be that we have all the different modalities, the surgeons, the radiation doctor, and the medical oncologist here to see patients and evaluation for what their best treatment would be. And also we delivered those treatments right here in one place. They know where we are and we're easy to get to. And that's very much different than some of the other cancer centers that are in our catchment area. So I think the advantage of coming here is you get to know your doctor, you get to see the same doctor every time that you come, and that helps you also to figure out what the right answers are for your particular cancer.
During this cancer battle, because it is a battle, Lord, give me strength. Help me to make the right decisions, to stay focused on this thing, to put the right doctors and surgeons in my life. And what did he do? He gave me Sinai-Grace. And I gave them the trust of my life. And they gave my life back.
If you've been diagnosed with cancer, come hear how our doctors can help. Call 313-966-4800. Sinai-Grace Hospital prides itself on great patient care, and now we're upping our standards again. Our inpatient rooms now have new whiteboards with a whole lot of great information.
We have up on the floor, this is a board to help us keeping communication up to. Our new whiteboards are here to help us facilitate taking care of our patients, to involve the patients in their care and their families. We involve them in day-to-day care, what to expect during the day, and how to facilitate with their discharge, so that on the day they come to the floor, we actually talk about their discharge and when they're discharged and what they need.
The purpose of these boards is to keep the patient and their family better informed about their care.
Well, we come and visit our patients on an hourly round, and we ask them about their pain. You know, we ask them what level they're at, we give them a score of 1 through 10, and then we also ask them, is their pain medicine working? Is it helping them? And we also can call the doctor and get something else for them if it's not. And we also, on the whiteboards, write down when their next pain medication is due, so they can keep track of themselves, so they don't have to constantly call the nurse. That way they can kind of keep track of their own care. Reviewed, and I also need to know your pain level. I have a score of.
Patients say they appreciate the added information, and it helps put them at ease during their stay.
So we can communicate with each other and with the patient and have all the information up there, so we know where the patient's at when we come in the room. If we're relieving the nurse or taking over on the next shift, you actually know where they're at.
Sinai-Grace patients also appreciate the great work of our nurses, and there's no better time than now to thank them for their hard work. In the month of May, National Nurses Week recognizes the dedication and commitment of the more than 3 million registered nurses nationwide. Here at Sinai-Grace Hospital, we have 773 nurses working around the clock.
Good morning.
Good morning.
A nurse is someone who not only has the knowledge, it's the scientific knowledge, as to provide the care that is needed in terms of making sure that that patient is being monitored looking at the patient's disease process. It's really a conglomeration of science, of art in terms of the skills, of compassion. If I had to, I probably couldn't put one single thing because it is a mixture of different areas.
In recognition of National Nurses Week, Sinai-Grace has named Shawn Mattison-Doster the 2012 Nurse of the Year. Shawn has worked for the DMC for 24 years and is currently giving great care to the patients on 6 East.
I look at the patients as though they were me, and how I would want to be treated as a patient, or how I would want to be cared for as a patient.
There you go.
What keeps me motivated is to see a patient come in so sick, and knowing that I did all that I can do and see them go home well. That's such a wonderful feeling. It's an honor, and even to see them at the mall, you know, after being so sick and seeing them at the mall and they're doing so much better, that's an awesome feeling.
Shawn received the Nurse of the Year recognition based on patient feedback and peer recommendations. Congratulations. Millions of Americans deal with chronic pain every single day. Leslie Harding reports that thanks to an innovative program at Sinai-Grace Hospital, these patients don't have to suffer anymore.
How was your sleep last night? If you didn't get a full night's sleep, how come? 1 in 3 Americans lose about 20 hours of sleep each month because of chronic pain. In fact, chronic pain affects more Americans than diabetes, heart disease, and cancer combined. I caught up with Dr. Maryjo Gavin of the Functional Recovery Program to find out how we can help those 116 million Americans who live each day with pain.
Acute pain is the kind of pain that people experience when they have an injury disease process. So, for example, a sprained ankle. You sprain your ankle and it hurts, and when you put the ice on it or you elevate it and you stay off it for a while, it heals up and the pain goes away. That's acute pain. Chronic pain is actually a disorder of the nervous system. Basically, the brain, the nervous system has this pain circuit that is sort of dysfunctional and keeps registering pain even though the area that was initially hurt seems to be all healed up.
Sinai-Grace Hospital has developed the Functional Recovery Program to help ease chronic pain.
The Functional Recovery Program is a unique rehabilitation program that takes a very comprehensive what I call interdisciplinary approach. We basically look at all of the factors that affect the experience of chronic pain. And if we are to successfully rehabilitate chronic pain, we have to look at all of those factors. The physical factors, the psychological factors, and the social and family factors that are affected by pain. When we address all of those issues, we're able to get people to be more functional again, get back to their activities, reclaim their life, even though perhaps they still have to deal with residual pain. Our hope is that when people leave the program, they have the knowledge and skills to independently manage any residual pain problems and still stay healthy and functional in spite of whatever pain they may have.
Who would benefit from this program?
We get people who have had chronic back pain. Many of them have had multiple surgeries. We get people who have had pain after injury of some sort. Many of the folks that we see have had residual pain after car accidents. We have people who have been diagnosed with fibromyalgia, which is a generalized pain disorder. What we do is we get people mobilized again, and then we teach them what they can do so that they can get back to all of these activities that they haven't, perhaps maybe haven't been able to do because of the pain.
And the success rate of this type of treatment is very high.
Across the board, patients report less depression, less anger and frustration, less anxiety. Most of them are sleeping better. Sleep is often disrupted by chronic pain. Most of them report improvement in their relationships because they're doing things, they're socializing again. Many will say that their self-esteem and their hope has returned, that many of them became very despondent because their lives had been so disrupted by this problem.
You don't have to live another day in pain. Contact the Sinai-Grace Functional Recovery Program at 248-968-5393.
Is it true that you should put a raw steak on a black eye to soothe the pain?
Absolutely, you should not waste a raw steak. What you want to do is put ice on your eye and come on into the emergency department so that we can check you out. So this myth is busted.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. I'm Melanie Moss. Thanks for watching.